Evidence-based program, not on tobacco. Thelma Brooks, Principles of Public Health, University of New England. The Centers for Disease Control and Prevention state that a third of teen smokers will die of smoking-related diseases. The Substance Abuse and Mental Health Administration state that 4,000 teens initiate tobacco use every day. Therefore, smoking cessation programs were created to help teen smokers quit. The American Lung Association Not on Tobacco program is an evidence-based program for voluntary teen smokers, 10-hour-long sessions weekly versus brief intervention using self-help brochures. It also consists of same-gender groups of 4 to 12 teens and same-gender facilitators. Target population was 2 Central Appalachian states that were in federal identified Central Appalachian regions. There was a total of 20 schools for a total of 258. West Virginia had 136 with 63 in the not schools and 73 in the 5 BI schools. North Carolina had 122 with 61 in the 5 not schools and 61 in the 5 BI schools. The factors that included types of community, student population size, student-teacher ratio, geographic location, and economic status. The program goals for teens to quit smoking, increase quit rates, and create a healthier lifestyle. Although teen smokers are at risk for health issues later in life, not on tobacco smoking cessation programs are more successful in teens quitting or reducing cigarette smoking than BI or no intervention. The study also compared the efficacy of the not with the brief intervention. There were several factors that had an impact on the effectiveness of the program. Students had to have a carbon monoxide reading of less than 9 ppm to be considered a quitter. Only 50% of the students were available for post follow-up. West Virginia received $5.8 million from the Tobacco Master Settlement Agreement from the 4 largest tobacco companies. This caused West Virginia to have better quit rates while using brief interventions. A 15-month phone interview follow-up was conducted with only one question being asked, "Are you still smoking?" And there was no CO reading collected. The diverse perspectives of the target population on rural youth start smoking earlier, have a higher risk for health issues such as developing smoking-related mortality and morbidities later in life. Rural youth are also less educated with higher smoking rates. More teen smokers are in rural areas, and the American Lung Association wanted to determine if NOT was a successful smoking cessation program. The study determined that NOT was more successful than BI, but that any intervention should be considered for smoking cessation. Life experiences should be considered for smoking cessation program, such as poverty, cultural traditional values, and customs. The health priorities of the community are to have healthier lifestyles, increase physical activities, better cognitive skills, and improve stress levels for better coping skills. NOT is a school community-based program allowing for a more depth look at targeted populations. Half of all the participants were still involved in the Not on Tobacco program 15 months later after it began, and they attended 70% of the program. Teen smokers either quit or reduced the number of cigarettes smoked better than no intervention. This resulted in a change in the community. Yes, smoking cessation can promote a healthier lifestyle, and youth can be more active in the community. As Snyder stated in the introduction to public health, we must understand what influences people to behave in healthy and unhealthy ways. The key players for the Appalachian teen smokers not on tobacco 15 months later were the American Lung Association because they recognize that there is a need for smoking cessation programs. West Virginia University Prevention Research Center's goal is to examine the underlying behaviors and social conditions related to tobacco use, sedentary lifestyle, and poor nutrition. The Centers for Disease Control and Prevention has a cooperative agreement with the West Virginia University Prevention Research Center and with universities across the country regarding public health issues. The authors of the study were with the Office of Drug Abuse Intervention Studies at West Virginia University. Horn and Dino were also with the Department of Community Medicine and the Prevention Research Center at West Virginia University. Most importantly, the teen smokers who participated voluntarily by consenting to either quit smoking or decrease the number of cigarettes smoked per day. External stakeholders were the local and state school systems who determined the need for smoking cessation programs on school campuses. West Virginia University Centers for Public Health assisted with research and training. Centers for Disease Control and Prevention supported the Prevention Research Center with the West Virginia State Health and Education Department at West Virginia University. The Community Resource used for the study were state and local school systems. Parents and families were required to sign consent forms for teens to participate in the study. This allowed families to provide support to the teen to increase quit rates or decrease how many cigarettes were smoked per day. West Virginia Prevention Research Center researchers conduct culturally appropriate research that benefit the health of people of Appalachia, which includes the states of North Carolina and West Virginia. The study was funded through the West Virginia University Research Center through a cooperative agreement with the Centers for Disease Control and Prevention. Not on Tobacco is funded by the American Lung Association, providing the facilitators and the curriculum. Other funding can be obtained from numerous sources such as local, state, and federal government programs and agencies. Private or community-based foundations and youth-focused organizations are also ways to obtain funding. Local schools and parents can participate in bake sales and parents through fundraisers to assist for smoking cessation programs. Most adult smokers who state that they started smoking by age 18. Researchers have shown people who start smoking during adolescence have a harder time quitting even after several attempts. Most people can progress through the first 3 stages of the trans-theoretical model, but are unable to reach the action stage. Snyder states that this stage requires the individual to modify their behavior by abstaining from smoking or adhering to a healthier lifestyle. These reasons are why community buy-in are important. Teen smokers become successful quitters. Sharing success of 21% quit rates to local, state schools and communities will allow other teens to want to become successful too. Sustainability can equal success because Snyder states that if individuals can successfully enter the trans-theoretical model maintenance stage, they can achieve a healthier lifestyle, but still strive to prevent relapse. Having relatability facilitators who use experimental activities, peer group discussions, and journals to engage teens to reach the underlying reasons why they smoke. Social media as a new technology can increase attendance, but to also increase quit rates. Community social fundraisers could add to the community buy-in in those rural Appalachian states. Ethical concerns are always an issue, and the Not on Tobacco program is no different. The Office of Human Research Protection Statutes 46.116 and 46.117 discusses the general requirement and consent documentation of a minor to participate in research. Parents or caregivers were required to sign consent for minors to participate in the Not on Tobacco program. The Children's Health Act of 2000 requires the Food and Drug Administration to bring regulations adopted from the U.S. Health and Human Services and the U.S. Department of Education to provide special protection for children participating in research. Other concerns that the authors could have encountered are issues with confidentiality and follow-up. The participants of the program were to remain confidential. Students were required to be available for follow-up 6 months after the start of the program, along with carbon monoxide testing in person to verify no smoking. Minimum follow-up documentation led to opponents of the program. One of these main opponents is Why Quit, a website which questioned whether the 21% quit rates that the CDC and the American Lung Association list on their websites were accurate. The websites also state that the authors used funny math relating to the outcome of teens that quit smoking compared to other programs. Why Quit also asked why the CDC stated on their website that the Not on Tobacco program is a model program when several questions were not answered. Another reason listed as a program failure is that not consisted of one-day facilitator training of educators already employed at the school. To participate in the smoking cessation program, students were required to limit smoking a certain number of cigarettes per day, including weekends. The number of students that used oral tobacco were not able to participate in the study, leading some to question the validity of the study because all teens who used tobacco were not included. The study showed that non-rural youth fared better in the study versus rural youth because they were recalcitrant. Snyder stated that the most important predictor of health is social economic status. These factors led to rural youth engaging in riskier behaviors and having health disparities in future tobacco use related to chronic diseases than urban youth, thus resulting in the need for the program. Appalachian rural youth tend to have higher smoking rates and begin to smoke earlier than youth in other parts of the country. Furthermore, Smoking-related illnesses cost more than $300 billion between medical care and loss in productivity in teens to continue to smoke into adulthood. North Carolina is one of the 19 states accounting for 80% of tobacco production. North Carolina was one of many states that was involved in lawsuits resulting in the Master Settlement Agreement. Those factors all contribute to the need for the Not on Tobacco Smoking Cessation Program. Understanding the rural youth can be uncooperative at times to authority. Developing a program with dedicated days, time, and monitoring versus brief interventions would be more effective. The Not on Tobacco programs are successful for many reasons. The facilitators are American Lung Association trained teams that are usually part of the community as educators, school nurses, counselors, and volunteers. Facilitators are staffed with the same-sex participants, with the groups being separate by gender, allowing the teens to discuss personal issues. The teens are also able to discuss teen-related issues and use teen-friendly language. Total of 10 sessions every week for at least 1 hour is the platform for the program. The program also integrates nutrition and physical activity. Dino stated that adding physical activity to NOT may enhance cessation success, particularly in boys. One of the key factors to the success of the program is student buy-in because all student participants are voluntary. Short-term effects of the Not on Tobacco program are to increase quit rates and or reduce smoking altogether. One risk with the program is that there is not enough follow-up months after the initiation of the program. The interviews are conducted by telephone without carbon monoxide testing to confirm the teens have quit. With every teen not being accounted for, this could cause them to relapse. Another risk factor are the immediate health consequences such as the increased respiratory distress and illness along with decreased physical fitness. Those consequences can result in higher risk for health issues. Immediate long-term effects of the program are the American Lung Association allows options for extensions into 4 booster programs to allow teens who need extra time to reach their goals. Once these teens identify the reasons why they started smoking, they cannot have excuses to not quit. Many adolescents start smoking and continue to smoke because of peer pressure and the need to continue to fit in with their social circle. Some do not have the cognitive skills to deal with the stressors, allowing them to start or continue to smoke. The Not on Tobacco Smoking Cessation Program allows teens to develop their cognitive skills. Not on Tobacco Smoking Program is a school community-based program allowing continuing social support to prevent relapse. Teens who do not start smoking or maintain abstinence will have a healthier lifestyle and reduce their long-term health costs. The Not on Tobacco Smoking Cessation Program is a model program with successful quit rates, allowing the scalability to increase on the local, state, and even federal levels. The program is suitable for all youth at no cost to schools or the community. The American Lung Association provides all literature and brochures for the facilitators to use. One important note, students who participate are exempt to suspension for smoking on campuses per the school's tobacco policies already in place. The Not on Tobacco Smoking Cessation Program for its scalability are recognized by the National Registry of the Effective Programs. My references are listed.